Here are some potential risks of drinking too much coffee. 1. Caffeine overload. Coffee contains caffeine, a stimulant that can cause increased heart rate, restlessness, anxiety, and insomnia in large amounts. Consuming too much caffeine can lead to caffeine intoxication, which may cause symptoms like dizziness, nausea, palpitations, and even more severe effects like seizures in extreme cases. 2. Sleep disturbances. Drinking coffee, especially in the afternoon or evening, can interfere with your sleep. The stimulating effects of caffeine can make it difficult to fall asleep and reduce the quality of your sleep, leading to fatigue and daytime drowsiness. 3. Digestive issues. Some people may experience digestive problems such as acid reflux, heartburn, or an upset stomach after drinking coffee, particularly if they consume it on an empty stomach or have a sensitive digestive system. 4. Increased blood pressure. Regular and excessive coffee consumption may contribute to elevated blood pressure in some individuals, which is a risk factor for cardiovascular problems. 5. Addiction and withdrawal. Caffeine is addictive, and regular consumption can lead to dependence. Withdrawal symptoms such as headaches, irritability, fatigue, and difficulty concentrating may occur when someone reduces their caffeine intake or stops consuming coffee abruptly. 6. Pregnancy concerns. Pregnant individuals are often advised to limit their caffeine intake due to potential risks to the developing fetus. High caffeine consumption during pregnancy has been linked to an increased risk of miscarriage, preterm birth, and low birth weight. 7. Interference with medications. Coffee can interact with certain medications, either by reducing their effectiveness or increasing their side effects. It's essential to consult with a healthcare provider about potential interactions if you consume coffee regularly and are taking medications. 8. Increased anxiety and irritability. For some individuals, particularly those prone to anxiety disorders or sensitive to stimulants, coffee can exacerbate feelings of anxiety, restlessness, or irritability. 9. Bone health. Some studies suggest that excessive coffee consumption may be associated with a slight decrease in bone mineral density, which could potentially increase the risk of osteoporosis over time. 10. Acrylamide exposure. When coffee beans are roasted at high temperatures, they can produce a chemical called acrylamide, which is classified as a probable human carcinogen. While the levels of acrylamide in coffee are generally low and the overall cancer risk from coffee consumption is considered to be small, this is still a concern worth noting. To minimize the potential risks associated with coffee consumption, it's advisable to consume it in moderation. If you have specific health concerns or conditions, consulting with a healthcare professional can provide personalized guidance on caffeine consumption.